My name is Pamela Dean, and I'm a registered nurse currently in the state of North Carolina. I am working as a clinical auditor and a case manager for Geriatric Rehabilitation Company across the state of North Carolina. I have recently participated in a collegiate study and debate regarding the North Carolina Bill 2516, the alternative to opiates in the emergency room. The bill is currently in the Senate. However, it was recently introduced back in March of 2018 and was read twice and referred to the Committee of Health, Education, Labor, and Pension. My argument for this bill to be passed is basically the staff can be much more educated with detailed education of proficiently trained to manage pain, as opposed to the current regulations and guidelines in the state that have nothing more than a mere few hours of orientation and education given to providers and physicians in their medical program. Many individuals in the long-term care setting are suffering if this bill comes to pass. And the reason that happens to be is because of the chronic long-term debilitating conditions that these people suffer. I feel like if this bill gets passed, these people will result in looking for alternatives, potentially even street drugs, or looking to provide their pain relief in manners that may be much more harmful to the patient, which is a very big concern. My personal stance, of course, is that I personally believe this bill should be passed for a multitude of reasons. They happen to be the fact that I believe that the funding and the education that would be provided to not only the nursing staff, but physician providers and nurse practitioners would be of great benefit not only in understanding pain management, but be able to manage these patients and acutely understand why they're suffering or what could potentially make it easier without the use of opiates. I also believe that this would be beneficial for the fact that we would be able to have decreased times in the emergency room and potentially decreased cost to not only the patient but the facility by having this passed and having less time in doing different types of pain checks and watching the patients for reactions after giving opiates, make sure they're not having respiratory distress and that type of thing. I also believe that hopefully if this bill does get passed, that the insurances will also be pushed and forced to actually cover these types of alternative and contemporary treatments. The next step in this bill, in order to be processed, is to be reviewed by the Committee of Health and Education, Labor, and Pension, and hopefully to have it go back through the House and the Senate in order to get approved. I think that the bill definitely should be passed. However, I do think there should be a couple modifications to it. I believe that it should be extended not only in the emergency room but into all healthcare settings. But definitely should be passed and go through legislation and signed into law. Thank you and have a great day.